Welcome to Make America Healthy Again. Join Dr. Charles Antinori and friends as they share solutions, tips, and insights that only doctors know for creating better health. Here's Dr. Antinori.
This is the Make America Healthy podcast. I'm Dr. Charles Antinori, and I'm here again with my brother, Joe, who's also a doctor, a family practitioner down in North Carolina, who's taking a little break in Brazil right now. You want to introduce yourself briefly, Joe?
Yeah, thanks for having me on the podcast again, Charlie. My name is Dr. Joseph Antinori. I'm a primary care physician. Been in practice in rural Appalachia and at the VA in Asheville for the last 20 plus years. And I think after our last conversation, we decided we needed a separate conversation to discuss the business or the healthcare industry in different, not just in medical terms.
Yeah. So you want to kind of talk a little bit about how the history of how medicine got so expensive,
Right. So, I think the headline is that, the United States spends an inordinate amount or a disproportionate amount of money on healthcare as an industry. I think the most recent estimates are about 18% of the GDP, which is like just behind, the defense as a percentage of our economy. And this is different from most other developed nations where they tend to be in like the 8 to 10% of their GDP.
This one's right. The biggest, the most is 8 to 10%. Switzerland's second, according to that book I was telling you about, Ezekiel Emanuel, and they're like around 10%, something like that. Yeah.
Right. And so, you often will get some kind of headlines that say like, what's wrong with healthcare in America? Why is it so expensive? And why are our outcomes so poor? And there's a kind of a thinking understanding that it's all inefficiency or something. And I think that that's not true. I think so. We can talk a little bit about, how did we get to this point and why is it like that? So going back, you and I looked at a graph earlier this morning that showed that in like 1970, the United States was not an outlier in terms of our expenditure on healthcare. We were in that, 6-8% range, along with Canada, Germany, United Kingdom, Japan, etc. Yeah. Yeah. And then, it's a gradual kind of departure from everybody else has kind of increased a little bit, but maybe they're now up to 10 or 12%, and we're at the 18%. But we really separated from the pack somewhere in the 90s, and had just experienced incredible growth in our cost year over year. And why is that? What is the cause? Why do physicians often disproportionately bear the responsibility, or the public would kind of think that it must be the doctors that drove or are driving these costs? And I would like to argue that, that's not the case, and that the bigger issue is maybe what happened somewhere along the line there is that the physicians lost control of the healthcare industry, maybe even before the 1970s, and it became a profit-driven capitalist endeavor, just like the auto industry or oil. And that's why the costs are so high, because people are profiting from this.
Just interject something about that, Joe, too. That 65 is when Medicare got passed. So I think that's definitely, and as we discussed briefly, that, before Medicare, health care is still a huge cause of bankruptcy and everything. Healthcare was a smaller number, in most budgets, and Medicare allowed healthcare to really, really grow. And I remember I was old enough at that time, and I knew I was going into medicine. I remember reading about it, and the doctors, and again back then the AMA, as you're going to point out, the doctors were almost all family practitioners up until around that time, or around GPs, and they were all in the AMA. And the AMA was tremendously powerful, and the AMA fought against Medicare because they didn't want to lose control of the industry. And they lost, but in losing, they initially got a great deal where doctors were paid 75% of usual and customary. So all of a sudden you got paid for all these things that you never used to get, paid for, and that really, I think that's the link that you're talking about. One of the things that started the real cost expansion, and I remember thinking through all my career, early training and everything, like, why did these guys fight Medicare? Because like, this is the greatest thing. It's paying for everything,
Yeah.
but they were right. And now in the last 10, 15 years, I'm thinking, they were right. We lost control of our industry to the government and to the administrators,
I think, the going further back to that history, like
Yeah.
we talked about, it was only, what did you say, 1935 with
Yeah.
the introduction of penicillin that, going to the doctor, even you had a better chance of profiting or benefiting, that the doctors did more good than harm,
Right.
only after like the 1930s.
Yeah.
And so, the healthcare industry, we just couldn't do all that much. We
Right.
didn't have all of the diagnostic testing, the surgical techniques, and just the treatments, the drugs, the understanding. So, somewhat the costs are clearly tied to the explosion in what we actually can do and treat
Right.
and how to practice medicine now. So technology, comes in even just from like plain X-rays to CT, ultrasound, MRI, now, more invasive diagnostic stuff. So, but Medicare paying for those things, I guess maybe they had to figure out like somebody was going to pay for it. And if it had stayed, I guess the alternative would be like if it had stayed fee for service like the dentists, would we be like, letting kids die from ruptured appendixes because their family couldn't come up with, 10 grand on the spot, like the dentists, I don't think we would,
Yeah.
So, that was part of that back history, is that there were very few specialists up until, World War II. Most physicians in practice were general practitioners in the community. And, they didn't have a whole lot to offer. Vaccines started coming in, antibiotics. But, the general practitioner really didn't treat a whole lot of heart failure, diabetes. They weren't that good at treating a lot of these entities that we now maintain people at great expense for, decades. And then when Medicare started is really when surgeries and specialists started making a lot more money than general practitioners. And you see that, the divergence of salaries, progressing from maybe right there in the mid 60s and 70s to now, the disparity is pretty high.
Yeah.
But we should also throw in the other actor in that equation when we talked about healthcare costs and, this large percentage of GDP. In 1965, the hospital administrator was not a highly paid person, and now 30% of all healthcare costs are hospital costs, which includes a lot of overhead, a lot of administrative people. And some of these people are extremely well paid, better paid than the physicians for sure.
Well, yeah. And let me interject a few things on that point. One is like when I started out in 1980, the busy surgeons expected to be making more than like the CEO of the hospital. I kind of remember Cooper, a busy surgeon would be making a couple $100,000 a year. I think the CEO was making like 180 or something like that. Now it's completely, now the CEOs are all in the million category or very close to a million, even in small hospitals, and surgeons are, lucky if they're making $300,000-400,000 anymore. And like I told you, that around 1990, when people started noticing that our GDP, that medicine was around 18% of the GDP and rising rapidly, but people started making some cost adjustments to medical care. I was just happened to be looking at Philadelphia Inquirer, and they looked at it and they compared 1970 to 1990 to see what was going on. They looked at the number of doctors, about the same. They looked at the number of nurses, was about the same. They looked at the number of hospital administrators, and it had
Right.
increased exponentially, in that time. So that's, again, that's not the whole explanation, but that's also another big factor. I think drugs is another big factor, but
Yeah.
yeah,
And there's whole other categories, home health services,
right,
you
yeah,
know, physical therapy, prosthetics. I mean, there are like huge industries that just basically didn't really exist.
right,
Um, and out of that large percentage of our gross national product, I think one of the things that's really frustrating for me as a primary care doctor, and probably for you as the general surgeon, is that we're still sort of like the face of healthcare.
right,
That so when patients have negative experiences with the healthcare system, when they're in the hospital and they're confused, and then the bills start showing up and the paperwork starts showing up at their house, and they're baffled by the trying to decipher this stuff. Really, they come to me, the primary care doctor, and oftentimes I'm the only person that they can sort of vent all of this frustration. And, the primary physicians, out of that 18% of gross national product, all physicians get 20% of that money. And primary care doctors are 5% of all healthcare dollars are to a primary care doctor. So, it's frustrating often to be the kind of like the one who receives, the brunt. I'm like the customer service representative for the healthcare industry.
yeah,
And really, I'm not the one who is benefiting. Now, have I made a good living as a physician? Yes. Is it an honorable profession? And am I happy that I chose to go into it? Yes, I am. You know what I mean?
right, yeah,
But we're still not. I just don't think that we should be. Often we are perceived to be the bad guys,
yeah,
and we're carrying the water for MBAs and lawyers and hospital administrators and business people who are really the ones who like the status quo.
right. And yet reading that book I was telling you, we were talking about this Ezekiel Emanuel, who has the best healthcare system.
Yeah.
He talks about that a lot of the countries are, general practitioners are like there's a whole category of general practitioners, and
Right.
it's a big chunk of the practice, and they are really looked at as gatekeepers. But like I say, that the bad thing is you get the criticism, but at least in most of the countries, you kind of have to go through the general practitioner, which you kind of still have to do in the United States too. But,
I mean,
but
there's it's well documented that primary care doctors are cost effective.
yeah,
That having a primary care doctor, seeing your primary care doctor, even for a telephone visit, keeps people out of the emergency room, avoids hospitalizations, preventive medicine, like
right,
checking up on people's blood pressure and their diabetes, decreases their rates of heart attacks and strokes. And, it's not, this is not a controversial idea. So the ideal is supposed to be 50% of all physicians should be primary care doctors. Supposedly that would be, an optimal for the industry, and we would save a lot of money. But right now we have about 25% and shrinking because primary care doctors are leaving
right,
the field, in droves, such as myself, currently taking a sabbatical, after 20 plus years of 100% clinical practice. And fewer medical students are going into the field because, they know that it's one of, if not the lowest paid field, and the perception that it is not very well respected, and that the work-life balance and job satisfaction is not good.
yeah. To get back, just throwing some things in about that book, the Netherlands, the family practitioners really consider themselves the gatekeepers.
Uh-huh.
I've been there for like a week in Amsterdam, and you can see that almost very fastidious people, very
Yeah,
smart,
yeah, right.
business
Yeah,
oriented. Have you been
right.
in the Netherlands? Yeah,
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 yeah.
yeah, yeah. And So, and they consider themselves like they don't want to refer you for anything, like they can,
Right.
they figure they can take care of like 90, percent
Well,
of stuff.
yeah. And I
It's
hate
like
to
a
say it,
matter
but
of
the
pride,
VA
which is
is
like,
like that too.
yeah.
The
And
VA,
is that right? The VA like that? Yeah.
oh,
Yeah.
the VA, well, this is a whole other topic, but the specialists at the VA are salaried, so they don't want to see patients, they don't want to do surgeries, and they don't want to talk to people who have, irritable bowel syndrome,
Right.
some of the things that in private practice, the primary care doctor can hand that off
Yeah.
to a gastroenterologist and say, this is your problem, kind of exceeds what a primary care doctor should manage. I
Yeah.
want you to go see this specialist. And in the private sector, the specialists will usually take over the
Right.
management of those people. But in the VA, it's like, no, the specialists just dump everything on the primary care doctor. And, it is more efficient that way because the primary care doctor can do 90% of most things,
Yeah. The other thing, and I
endocrinology.
mentioned in my book, that, I think drives healthcare across the United States is litigation, malpractice, and everything. So everybody has to be, covering their ass, because
Right.
you got to get the test,
Yeah.
you got to send the guy for the referral, you can't just play it down because if it turns out, if your judgment is that this is really not a big problem, you really don't need to see that gastroenterologist. You really don't need to see the surgeon, blah, blah, blah. But
Right.
then if something goes wrong 5 years down the line, you're in
Yeah.
trouble,
Yeah.
and this has evolved like I talk about in the book when I was an intern in 73 in Columbia, in the ER. We spent a lot of time in the ER, and they put us in there. We saw all the head trauma, for example. I'm sure the reason we saw it rather than in neurology residents is because there was so much of it. The neurology residents would have done like a complete exam. It would have taken like 2 hours to see one patient. So they had
Yeah.
like the general surgery residents, doing this, and
Yeah.
we would examine them. We'd look at even like looking at their eye grounds and things like that, and end
Yeah.
up giving them a head sheet, tell the mother like, here, go home with this sheet of kid, wake the kid up during the night. If he vomits or anything, bring him back, all that sort of stuff. You look at his eyes, make sure that the pupils look the same, all that sort of thing.
Right.
Good cost effective. You couldn't blast him out of the emergency room without getting a skull film, which had very little chance because we didn't even have CAT scans then. The head CAT scans didn't come in for like another 3 or 4 years. And originally it was just head CAT scans, when CAT scans started. But, so it was skull films. And, like I said, I remember vividly the skull films were like $65 a shot, which is peanuts nowadays, you know what I mean? But but I was making like $50 a day for working 24 hours in the emergency room. And I would order probably an average between 5 and 10 useless sets of skull films every 24-hour shift that I was on call. And I talked to my the program director about it. And he told me? Get the skull films.
Oh, yeah. Yeah.
That's been the philosophy like ever since.
Yeah. Well, there is the cover your ass certainly drives up our costs, and that, the fact that there's a malpractice industry
Right.
holding physicians to the standards of accountability. And, in fields like OBGYN, it really is absurd. We've lost like contact with common sense. 2 generations ago, there were fairly significant infant mortality and maternal mortality.
Yeah, right.
And now, everyone wants to believe that if something goes wrong, it's got to be the doctor's fault.
Somebody did something wrong.
And,
yeah.
So that's more of like a bizarre modern like ignorance, and
well, it's the litigation. I mean, guys like there was a guy that he was like running for vice president. He was an attorney. He was the one. He got multi-million. John something around black.
Edwards, John Edwards.
Yeah,
who's
John
from North
Edwards,
Carolina,
who was like making a big deal about his wife having cancer, and turned out he was cheating on her. I mean, the ultimate, liar. And he made his money suing hospitals, and he would like pretend to be the baby and stuff. And he'd get like these $20 million settlements for the family, which would be like 20-30% to his firm,
Right.
Yeah.
Well, in most of those other countries, they have some kind of a fund, for bad outcomes. And,
Yeah.
And you know what, honestly, when you remove that litigation from the physician-patient relationship, it's a better relationship.
Right.
Like
Right.
the patient should automatically feel that the physician is on their side and he or she is there to help them, and not to be, like, oh, I'm here in the hospital. I can't wait for this. Could be my big chance to sue somebody.
Yeah.
But those are really big problems that I think,
Well, the other thing,
that's like an American, problem,
right.
and we're not going to get rid of it. The one that I find more interesting from my experience is, and I may have told you this story before, there was an older physician in practice in Burnsville when I went there, pediatrician, and this guy had been a pediatric cardiologist at the academic medical center in Richmond, Virginia. And then at the end of his career, he was like, I just want to go be a simple country pediatrician, and get back to the roots of taking care of babies. And so, there's that mindset that, like, oh, I was a big shot pediatric cardiologist. Of course I can do, community pediatrics because it's easy, right? Well, not so much. This guy was always looking for zebras,
Yeah.
So I can't tell you how many patients I would hear the story, Dr. XYZ, he sent us to Charlotte for CT scans, and we had to go back every 3 months. And then, finally they told us that everything was okay. You know what I mean?
Yeah.
But the patients would say, well, thank God for Dr. X, because he really cared. He was really worried about little Jimmy. And, it was, so this is like a story that the family tells about the trauma that they went through. Are they mad that Dr. X, thought that their child had a rare, renal problem based on not a lot of good evidence? No, they felt that he had, really cared for their child and sent them for a lot of testing. And this was they got to go to these academic centers, and they were the focus of all the attention, and everything worked out okay.
That's part of the mentality of America too. Like, people go to a family practitioner, internal medicine guy. They expect to come out with something. They expect to get sent for a test or get a pill or both. That's going to take care. And that's what I'm saying. The Netherlands, like, it isn't that way.
Yeah, I know.
The Netherlands, they kind of tell you, like, wait a couple of weeks and see what happens.
Right. And that is a healthier attitude. I mean,
yeah.
But to take it away from the pediatric to the geriatrics, where the bulk of our healthcare dollars are spent on geriatric patients.
Absolutely.
Sadly, we have a lot of people who their healthcare is their primary occupation.
Yeah.
Being in poor health for 10 or 15 years and going to multiple specialists and having lots of tests and being in and out of the hospital. This is what people do, and that's their full-time entertainment. And also, it does make them feel that they are valued as a human being.
Right.
That, people care about them because we're going to take care of you and this problem. And that drives a lot of healthcare cost.
Yes.
There are pockets in America where people, get more tests and scans and things because it drives up the costs. It benefits the doctors and hospitals too.
Yeah.
So, like, famously, McAllen, Texas, had like the highest. Everyone was getting a stress test every year. Everybody was getting an MRI, and I had access to this, data. We now reached $14,000 per year per person in the United States for healthcare, which is, off the charts, right? We said Canada and Europe are like 8,000 or 6,000 per year. But, there were places in Texas where every Medicare patient was costing like $25,000 a year. They
Yeah.
were just like, it was like a local industry. You
Yeah.
would see the primary care doctor and he would refer you to the pulmonologist, the nephrologist, and the cardiologist, and he would order an MRI,
Yeah.
and everybody was making money, and there was
Yeah.
no disincentive, not to do that.
Well, like I said, I don't get near wrapping up pretty soon, but like I want to mention too that I love the work. I mean, you do too. It is very satisfying work, and I really think the American system is I mean, reading this book about comparing the 10 systems, the author ends up ranking the United States kind of low, because even
Yeah,
though it's the most expensive, he ranks it like about eighth out of the 10
definitely.
I think that's, because we don't have universal coverage. A lot of the countries do, and, a lot of things like that. But on the other hand, we provide most of the innovation. We have the fewest number of people going into the hospitals, believe it or not. I mean, our hospital rate is one of the lowest in the world, but when you get there, it's expensive. And a lot of expensive stuff gets done as an outpatient. I mean, as a surgeon, I just think of my own career where when I started out, gallbladders, appendixes, hernias, all spent days, sometimes a week or more in the
Right.
hospital.
Yeah.
Now 90% of that is done as an outpatient or like stay overnight or something like that,
Yeah.
and technology, things like, stents, cardiac stents basically put me out of the cardiac surgical business,
Yeah.
but those kind of things cost a lot of money. That tiny little stent that looks like the spring that's in this pencil costs
Right.
a pen, costs $3,000. Now we
Right.
used to get paid
Yeah.
like nowadays a surgeon for doing a coronary bypass gets about $3,000. We would get like about
Wow.
$6,000,
Yeah.
back then. But now the surgeon's getting like 3,000, and some company that's making that little,
Right. Yeah.
and they'll put like
The
sometimes they'll
stent
put
is
three or four of them
10,000.
in.
Yeah.
And
Right.
also there's a cost for the thing to push them in and the X-ray machine and
Sure.
everything else.
Yeah.
But we
Yeah.
have the best system. Like I say, now working semi-retired in wound care, I see all these cerebral palsy people. These people have been taken care of from birth. They're in their 60s and
Right.
70s.
Yes.
I mean,
Right.
what a great job we've done. But it's
Right.
really expensive.
Really.
Anybody that's had to put their family, a parent or something, into a nursing home, and even
Yeah.
one that even people that can more or less take care of themselves, if they go to a nursing home in our area, you're talking 15 grand a month,
Right.
for a rehab place.
Yeah.
These people have been totally taken care of for like, 60, 70 years, and
Right.
the cost is mind boggling, but we're doing it all. I mean,
Yeah.
and as we both said before, we may not have universal coverage, but I've never seen anybody not get any health care that they need.
Right.
People roll into the ER, they may not pay, somebody
Yeah.
has to pay for it somehow or other. But I've never seen anybody denied any needed
Sure.
health care,
Yeah. I agree. We're not the worst, and the cost. As we said, there are powerful people and industries that like the status quo,
Yeah.
and we as physicians are sometimes more the victims than the beneficiaries of the status quo. But I think the fundamental question of, is it a capitalist industry to maximize profit, or is healthcare something a little bit different, like a moral right? So nobody gets turned away from the ER, and we don't let anybody die from a ruptured appendix because that would be immoral, right?
Right, right.
But yet 60% of all personal bankruptcies are caused by medical bills in the United
Right,
States.
right.
It's by far the greatest cause, and everybody knows somebody who had to have a GoFundMe page for their young mother of 4 with breast cancer or something, and that feels like not the greatest moral indictment, or it is a moral indictment for the United States that when we spend so much money, we can't take care of people who really need the care sometimes.
Yeah.
I don't know what the answer is, but I guess I would like them to make it better for primary care doctors, for one, because the crisis in primary care is real. People are really burned out. The EMR, we didn't even talk about that, how
Right. Drove up
technology
costs
and the
tremendously.
EMR, what a boon it has been to the tech industry and increased costs and how many people make so much money off the EMR. And yet, has it made the primary care job better or worse? I think practicing doctors would tell you it's made things worse for us.
Yeah.
But, we as a people, if we could do something to incentivize primary care, probably do have to pay them more money. Maybe, you get loan forgiveness and stuff if you do it. Maybe they have to recruit people who are more likely to go into primary care. But, patients really do need a primary care doctor, and it would save the system money. And we would be, the people would get the care that they need, and we would get less care that they don't need.
Yeah, that was a big topic in all the 10 systems that this Ezekiel Emanuel looked at. And really, general practice is a huge cog in the machine of all the more efficient healthcare systems, put it that way, than here.
Yes.
Yeah.
I mean, it should be,
Yeah. It's another thing. You reminded me when we were talking about the obstetricians. It was funny. One time I went to Washington D.C. With Chris, and it snowed, like not a lot, like 4 inches, but the city was like paralyzed, So like so we went to we walked into the Washington Monument, we walked around the Smithsonian, but there weren't any people to show us around. So I was just like sort of stumbling around the Smithsonian, and I stumbled onto the hall of the wife, the first lady's gowns, the gowns that the first ladies wore when he was at the inauguration. The most amazing thing to me was until like the 1950s, the first lady was rarely the president's first wife, and you know why? Because they died in childbirth,
Right. Yeah,
or died from something. They died from something. And a lot of times it was childbirth. A lot of times the president's first lady was his daughter, his sister, his second or third wife, stuff like that. Because, and that, and they're talking about a fairly sophisticated, we'd assume that the presidents in general were among the upper echelon of the United States, in terms of savvy,
Yeah. But there was nothing they could do about it if there were still bad outcomes all the time. Like in even that, remember, I don't know if you watched Downton Abbey, but they had a scene where the young mother delivers and she dies from preeclampsia, and the physician is there, and he's just like, there's nothing we can do, I mean, we still don't really understand preeclampsia, but, stuff like that has always been around, and we do a tremendous job. Like, this is why 20% or 25% C-section, because nobody's willing to
take a chance,
and it's amazing. We should get more credit. The OBGYN should get more credit for the fact that, we do have like a 0.1% or, a very, very low mortality rate. I mean, they're actually defeating nature in many ways.
Right. Well, our brother Paul's company now is working on a preeclampsia drug. That's the holy grail for them right now.
I mean, it would be great.
I think they're in phase 2 clinical trials already, or something like that.
Yeah, I know.
Yeah. Anyway, I guess we probably should wrap it up, Joe. It's been great again.
Okay.
And I'm definitely going to, I talked to, one of my rewards for helping that girl, the 13,000 steps, I did literally my phone, 13,000 steps. And these were steps. They were not on flat ground. This was on that 3rd floor apartment. But one of my rewards is she's kind of interested in coming down to Brazil with me. So
well,
I'm definitely coming. I'm definitely coming in January, February. We'll have to work on the timing and everything, but we might be bringing her too.
I'm going to Rio on Saturday. So for a week.
Told me, I really want to hear, because like I said, we would visit you. Here's the plan. We're going to visit you guys for like a couple days, and then we're going to like Rio or wherever you tell me. Wherever you tell me is the best place to go.
Right. Yeah, I'm living in the Hartford, Connecticut of Brazil. It's not like your first tourist destination. No. All right, Chuck.
Take it easy, man. See you. Bye-bye.
Good seeing you. Take care, brother.
Bye.